Good morning, everyone. It's a pleasure to meet you. Air travel isn't what it used to be, so it's not as easy to get from here to there, and I would love to be in front of you in person today, but hopefully I will be live for the Q&A. So bear with me. I think you're going to learn something about a very interesting breakthrough test dealing in the area of cardiac ischemia. They say, however, never really to start with an apology. So I think I'll do that. I know this is the IDCM, and I should be covering diabetes, and you're asking yourselves, well, why is he presenting a pure test on early detection of cardiology? I promise I'm going to come back to that at the back end. But bear with me, because I think you're going to see a really interesting test that you're going to find quite fascinating. Again, forgive me, just to cover for a second, the number one cause of death in the world and the number one cause of death in India is heart disease. And obviously, it's got very close ties with diabetes. That's true. You've all seen the studies in Lancet talking about prevalence of cardiac ischemia in the Indian population. You've seen the numbers: 15%, 28% of the population, 60% of the world disease burden, the heart disease burden of the world is in India. You have a way in your hands to actually deal with it and to reduce it. So let me get straight to what we're talking about. It's really an innovative test, something relatively new with a lot of medical evidence behind it. It's a test for early ischemia detection. It's a test for cardiac screening in healthy individuals. Now, my definition of healthy individuals, let's call it low to intermediate risk without no known heart disease. But the whole point here is that it's performed using a unique analysis. I'm going to get into the medical evidence in a moment, but it essentially is, you might consider it as an effortless TMT or exercise stress test. Because what we do is we simply record the heart rate using relatively simple monitors, heart rate recorders, commercially available. We record 20 minutes. We have a unique, medically proven analysis. Now, the devices themselves can vary. You can picture them yourselves, whether it's a smartwatch or it's a jogger's belt, or maybe it's an optical armband. Any way that's really collecting and recording heart rate. We collect 20 minutes of that. You collect 20 minutes of that. In fact, any one of you right now could be doing that test. The test is performed at rest. The data at the end goes up to the cloud for a very unique analysis. It's a multi-parameter analysis using 4 dimensions of mathematical correlations and parameters. And then you get a result which is parallel to either passing a stress test or not passing a stress test, whether it's correlated to the presence of ischemia or not. We can get into all of those as well, but I think what I would like to do, if I may, is cover some of the medical evidence. I'm talking as from one doctor to another, we're talking about medical evidence, and we work with evidence-based medicine. So let's have a look at some of the multi-center studies that were performed. They've been published. You can get those published articles very easily. Let me take the latest research that was done on 1,043 individuals at the Mayo Clinic in the United States. They took those 1,000 individuals who were low to intermediate risk. Maybe they had one risk factor, one or more risk factors. Obviously, no known heart disease, as I said before. And they applied our test. In other words, they recorded 20 minutes of data and got a result. They put the result aside. They then performed a regular TMT with the supervision of a cardiologist and the interpretation of the cardiologist, and then they compared the results of the same patients, the 2 tests. Now, what happens if there's a discrepancy between the 2 results? So the Mayo Clinic performed the 3rd test on the same individuals, the same 1,000 individuals. They performed an imaging test of the coronary arteries, whether that would be stress echo, or basically an ultrasound, or myocardial perfusion imaging using an injected dye. And the results were quite astounding. So they used that third test as the arbitrator. Who is correct? Heart trends, our test, or the treadmill test? And here's what they found. Heart trends, of those 1,000, let's look at the results on the left. Of those 1,000 that had ischemia or had some level of development, heart trends found 71% of those. The TMT, the treadmill test, only found 33% of those individuals. So that right there will give you an idea of the accuracy and the sensitivity of what our test can do. And as I said, it's done without stress. It's done in a relaxed, normal mode. We're trying to characterize the normal behavior of the heart, of the autonomic nervous system that controls the heart. And I'm going to come to that autonomic nervous system in a moment. So just as important, if a score was high, the way we work is a score above 2 is considered as passing a stress test or healthy, low risk, in other words, for presence of ischemia. Just as importantly, if an individual scored high on our test, there was a negative predictive value. In other words, they were 97% sure that this person is scot-free, is free, and this of heart disease. And so this is a very important metric for just feeling good and for good heart health, and maybe even as part of an annual health checkup. So let's compare for a moment, and I really would like to I'm going to initially start off with a simple comparison of a stress test, okay, to the heart trends, okay? But the point here is, it's going to be more than that. I'm going to get to that. Right now, I can tell you this. Heart trends is more accurate, as you just saw. It costs less, and it also is no hassle. There's no stress effort involved, as we saw. It's very suitable for those individuals that cannot take a treadmill test, the handicapped, the elderly, the overweight. You don't have to give dobutamine to artificially accelerate the heart. We want to measure and characterize the normal heart that's unaffected by drugs. And more importantly, people who come to take the stress test are typically in an advanced stage of heart pain, of heart disease. The purpose here is to catch it earlier. Okay, if 40 is a cardiac risk factor, you might consider starting testing the population at age 40, or maybe earlier if they have other cardiac risk factors. Now, just as important, what are some of the drawbacks of our test? Well, our test does not indicate the location of the ischemia or the percent occlusion. Okay, we don't do that. We don't have a 12-lead EKG to be able to see that. You can put that on, and that will give you added benefit if you like. And the test is not for those that have established coronary artery disease. Our test won't really add anything. But let's look at the flip side. What are the advantages of a TMT? The TMT really is for true sport athletes. You want to see how their heart performs under real stress, under very difficult stress situations. And so there a treadmill test would be called for. And as I said, typically a treadmill test will also have a 12-lead EKG where you're stressing the heart, and you can immediately start to see what the location of the particular arteries that are causing problems. However, some of the drawbacks of the treadmill test is fear and hassle of taking a stress test. Most people are scared as heck of taking a stress test. In fact, they think it'll cause a heart attack. It's less accurate, as you saw the medical results, and it requires the presence of a physician standing by who needs to spend those resources. So again, as physicians, we all want to see what are the inclusion criteria, and as I put here, it's for screening low to intermediate populations with no known coronary artery disease, typically one or more risk factors. As I said before, people over 40 is a risk factor, but if they're smokers or if they have a family history, you might consider testing them early. 90% of heart disease is reversible if you catch it early. That's what we're about. Of course, exclusion criteria, patients with known arrhythmias or a pacemaker, obviously that won't work. Atrial fibrillation, things like that. No drinking of caffeine or Red Bull before the test. That'll tank the results. And as we mentioned, also athletes should be taking a real treadmill test. Just to give you an idea, we're really being used now all over the world. It's the largest insurer in the world now recognizes heart trends as a replacement for the traditional treadmill test. Excuse me. And now let me come to probably the most important point over here. And that is, what is the connection between heart trends and why you are all here at this conference today? And the answer to that is simply the autonomic nervous system. Our test characterizes the autonomic nervous system behavior as it relates to ischemic heart disease, how the autonomic nervous system adapts itself to compensate for that developing ischemia. Well, it turns out that there is another disease, and you should all know about that. And of course, neuropathy. I don't have to tell you the effect of the autonomic nervous system on diabetes. We are currently starting in Denmark a research of long-term tracking for early detection of diabetes using the same measurements, different analysis, to come up with a predictor of diabetes. And so I might pose for yourselves to think about whether you'd like to join and be part of that future research, doing that tracking, using our system to use our heart trends for early detection of diabetes. And so I'd like to conclude here and open it up to questions. Basically, we are a very simple, easy test. You can all come up today and do the test right now as you're sitting. Come up to the stage. The representative in India has a few devices for you to do your own stress test. I know physicians hate to do that. So let me stop here. Let me thank you for your attention. And let's open it for questions. Thank you.